Fundamentals Chapter 10. Facial Devices and Technology. Learning Objectives. After completing this chapter, you will be able to explain the importance of the use of facial devices and technology. Identify the basic concepts of electrotherapy. Explain the benefits of the hot towel cabinet. Discuss the magnifying lamp and its uses. Discuss the Woods lamp and its uses. Demonstrate how to safely and effectively use the rotary brush. Demonstrate how to safely and effectively use the steamer. Demonstrate how to safely and effectively use the vacuum machine. Demonstrate how to safely and effectively use galvanic current. Demonstrate how to safely and effectively use the high-frequency machine. Demonstrate how to safely and effectively use spray machines. State the benefits and use of paraffin wax. State the benefits and use of electric mitts and boots. Identify why you should make informed decisions when purchasing equipment as a licensed esthetician. Explain the importance of the use of facial devices and technology. There are a variety of useful machines and devices that will enhance the esthetician's services. Each machine or device has a specific benefit for the skin and makes clients feel as though they are receiving a specialized service. In this chapter you will learn how these tools are integrated into facial treatments. Although facial treatments can be performed effectively without electrical devices, optimal outcomes can be achieved more readily with facial devices and technology. Estheticians should study and have a thorough understanding of facial devices and technology because they need to operate machines and devices safely, provide the best results for their clients, and enhance their service menu. It is vital to understand how to safely use each machine and device and the potential contraindications in using the machine or device. There are a variety of useful machines and devices and new high-performance tools that will enhance the esthetician's services, and it is important to be able to explain the benefits of each machine or device. To maintain professional credibility, estheticians must continue to be educated about the latest methods in skincare as new machines and technology emerge each year. Investing in high-quality machines and devices will increase both credibility and potential business revenue. Identify the basic concepts of electrotherapy. Electrotherapy is the use of electrical devices for therapeutic benefits. Electrical devices enhance facial treatments by making it easier to give a skin analysis, by helping to achieve better product penetration, or by exfoliating the skin. These tools are especially effective for more challenging skin conditions such as aging or sun-damaged skin. Machines and devices can be purchased separately or as multifunctional units with many of the modalities, machines, all part of one unit. Figure 10.1. Multifunctional machines are a popular option when trying to save space. Estheticians must continue to be educated about the latest methods in skincare, while being cautious of expensive, trendy machines. Lasers, light therapy, microdermabrasion, and microcurrent are some of the advanced machines discussed later in Chapter 13, Advanced Topics and Treatments. It is important to be familiar with machines and devices even if you choose not to work with them, as it is important to be able to educate your clients on the benefits provided. Today's clients are well educated and have greater access to information, and they will expect you to be knowledgeable about all skincare topics, trends, and tools. To maintain professional credibility, it is important that you are aware of current technology. General contraindications for electrotherapy. There are several contraindications for electrotherapy. These include the standard facial contraindications discussed in previous chapters. See Chapter 5, Skin Analysis. To prevent physical harm, some electrotherapy machines should never be used on clients with heart conditions, pacemakers, metal implants, or braces. Clients who are pregnant. Clients with epilepsy or seizure disorders. Clients who are afraid of electric current. Clients with open or broken skin. If you ever have any doubts about whether a client can have electrotherapy safely, request that the client get a note from their physician approving electrotherapy treatment. Ensure the client removes jewelry and piercings before using electrical devices such as the galvanic machine. Use all machines as directed by the manufacturer because similar machines may have different mechanisms and work differently. Most machines discussed in this chapter are used for approximately 5 to 10 minutes while being integrated into the facial treatment. Regulatory agency alert. Always make certain that you are in compliance with your state's recommendations for licensing and use of electrical current devices. Check in. What are 5 contraindications for electrotherapy? Explain the benefits of the hot towel cabinet. Towel warmers, also called hot towel cabinets or hot cabbies, are used to heat towels or products used in treatments and are commonly used in the treatment room. Figure 10.2. Hot towel cabinet. When to use a hot towel cabinet? Hot towels can be used for both face and body treatments. Cotton pads, 4 inches by 4 inches aesthetic wipes, and products can be warmed in a towel warmer or specialized product warmer. Some towel warmers are equipped with ultraviolet lamps. Ultraviolet lamps in towel warmers may reduce bacteria but are not effective for disinfection. Effects of warm towels from a hot towel cabinet. Clients who do not have contraindications would benefit from the warm, soothing, softening action provided by steamed towels, which can be used in the following ways. For removing facial masks and products such as massage creams. For softening the skin before performing extractions. Contraindications and best practices for warm towels from a hot towel cabinet. Hot towels should not be used on clients who have extremely fragile or extremely sensitive skin, uncontrolled or advanced rosacea, open wounds or contraindicated skin conditions such as excessive acne lesions. Before placing the warm towel on the skin, be sure to adhere to the following guidelines. Always test the temperature of the towel or product on your wrist prior to use. Towels should never be too warm or left on the skin too long because they can damage capillaries, cause overstimulation, and increase redness or irritation. Plastic melts in hot towel warmers, therefore, use heat-resistant dishes to warm products. OSHA alert. OSHA requires that you use gloves whenever you may be exposed to bloodborne pathogens. In reality, you have an exposure risk whenever you work on a client. Gloves should be worn at all times. It is important to understand that while working on a client, anytime you enter the hot towel cabinet to retrieve an item, you must first remove your gloves, or you will contaminate the cabinet door and entire contents of the hot towel cabinet. Once you remove the item you need, put on a new pair of gloves prior to returning to work on the client. Avoiding cross-contamination during any service is required by OSHA, as is the use of gloves, because you can be exposed to bloodborne pathogens the minute you begin any service. With advances in many products, ingredients, and advanced devices, you may find your treatment more geared toward a clinical approach when addressing product removal. These types of treatments primarily use 4 inches by 4 inches aesthetic wipes for removal versus hot towels. As you increase exfoliation or stimulation of the skin, as occurs with some advanced services, you will find that the use of hot towels may be contraindicated. Examples of such services are some advanced peels as well as in-depth microdermabrasion treatments. Preparation of the hot towel cabinet. Always follow the manufacturer's instructions, as there may be subtle differences in each device's use and optimum effectiveness. In general, these are the steps you should perform to prepare the hot towel cabinet. Put on gloves, fold a towel in half, and roll the towel up. Add warm water, squeeze excess water from the towel, insert the towel in the hot towel cabinet, and turn on the cabinet to heat the towel. Load the cabinet until you have the desired number of towels for your treatment or plan ahead for your full client schedule. Safety and maintenance of the hot towel cabinet. When you are ready to use the heated steam towel from the hot towel cabinet, put on a new pair of gloves and remove the towel. Test the temperature of the towel on the inside of the wrist over the gloved hand. If the towel is too warm, open it slightly and allow the towel to slightly cool and then retest the temperature of the towel. Open the towel and apply the towel to the client's face, never covering the nose and mouth areas. While the towel is on the client's face, you may apply gentle pressure to the towel to provide further relaxation. To remove the towel, gently begin at the top and work your way down, lifting the towel off the face. If using the towel for product removal, you will use the ends of the towel to methodically remove the product, working from the top of the face down and circling back to address any remaining product once the towel has been removed. It is important to keep the hot towel cabinet clean and free from mold or mildew. At the end of the day, clean the inside and outside of the cabinet with an EPA-registered disinfectant. Empty, clean, and disinfect the water catchment tray underneath the cabinet. Leave the door open at night to allow the cabinet and rubber seals to dry thoroughly. Check in. Why is it important to enter the hot towel cabinet with clean gloves? Discuss the magnifying lamp and its uses. The magnifying lamp, also referred to as a loupe, pronounced loupe, magnifies the face to help the esthetician treat and analyze the skin. Figure 10.3. Magnifying lamp. The lamp uses a cool fluorescent light bulb. The magnifying lamp has various powers of magnification known as diopters. 1 diopter is equivalent to 10 times the magnification. Most lamps in the industry come in values of 3, 5, or 10 diopters, which means 30 times the power magnification, 50 times the power magnification, or 100 times the power magnification, respectively. 5 diopters are the most common magnification. A good quality light should have a clear lens and be free of distortion. Since you are using this light often, any distortion will add strain to your eyes and make it more difficult to see the skin. Some skin analysis devices include handheld magnification tools, head visors, and cameras that view the skin at up to 200 times magnification and may include components that can assess the skin's hydration level. These devices are especially useful to track treatment progress in medical aesthetics or when performing advanced treatments such as peels or microdermabrasion. When to use the magnifying lamp? You should use the magnifying lamp during skin analysis to determine the correct facial treatment. During extractions. As a source of additional lighting when needed for a treatment. Best practices for the magnifying lamp. Lamps are designed to sit on a floor base or attached directly to a facial cart. The base that a magnifying lamp sits on may be sold separately from the lamp itself. Carts are not as mobile, so floor stands are preferred. It is worth getting a quality lamp that has good knobs that stay tight instead of one that hinges, as it will last longer due to all the constant adjustments that are used in positioning the lamp correctly for each client and treatment. Always use iPads when the lamp is positioned directly over the client. It is important to loosen the adjustment knobs before moving the lamp arms up or down. Follow the manufacturer's recommendations for adjusting the knobs to ensure the longevity of the device. If you force the lamp into positions without loosening the knobs first, you will wear out the hinge of the light and then it will not stay in position. To avoid overreaching and hurting your back or wrists, you may need to stand up to move and adjust the lamp. It is recommended not to adjust the hinge over the client's face or body. Safety and maintenance of the magnifying lamp. Magnifying lamps can last many years if they are well constructed and maintained. Conversely, if they are abused and roughly handled, their longevity is compromised. If problems do occur, they typically involve the adjustment arm. The spring on the arm can wear out and may break if not used with care. Some less expensive magnifying lights have hinges rather than knobs that adjust, but these usually wear out faster. Periodically check the screws around the light to ensure that they are not loose. The arm and bolt underneath the base may also need tightening. A simple toolbox with screwdrivers and wrenches is handy to have in the facility. To clean the lens, turn off the lamp, let it cool, and then spray it with a disinfectant and wipe with a soft cloth. Avoid using paper products because paper towels and tissues will scratch the lens. Clean and disinfect the entire lamp, including the base, after each use. Check in. What is the most common diopter for a magnifying lamp? Discuss the Woods lamp and its uses. The Woods lamp, developed by American physicist Robert Williams Wood, is a filtered black light that is used to illuminate fungi, bacterial disorders, pigmentation problems, and other skin problems. Figure 10.4. Woods lamp. Skin scopes are similar to Woods lamps. These larger skin analysis tools use a UV light with an interior mirror. A client can look at their face on one side of the scope while the esthetician looks through the scope and examines the skin from the other side. These scanners use a magnifying lamp and black light to analyze skin features such as hydration and pigmentation. When to use the Woods lamp? The Woods lamp allows the esthetician to conduct a more in-depth skin analysis, illuminating skin problems that are ordinarily invisible to the naked eye. Under the lamp, different conditions show up in various shades of color. For instance, the thicker the skin, the whiter the fluorescence will be. Table 10.1 provides some examples of skin conditions and how they appear under the Woods lamp. Table 10.1. Woods lamp reference chart. Not all pigmentation that shows up under the Woods lamp can be completely lightened with regular exfoliation treatments. Pigmentation located at the dermal-epidermal junction can only be addressed at the medical level. Only pigmentation on the surface of the skin can be potentially lightened by exfoliation treatments and lightening products. It is also important to let clients know that addressing pigmentation is an ongoing challenge, for example, with pigmentation associated with sun damage. Pigmentation can reappear if the skin is in contact with the initial stimuli of heat or UV rays. Contraindications and best practices for the Woods lamp. When using the Woods lamp, the room must be totally dark. Place small eye pads on the client, making sure the area around the eye is still visible. The bulbs can get hot, so be careful not to touch the skin or have the lamp turned on too long. Safety and maintenance of the Woods lamp. Treat the Woods lamp carefully, as you would a magnifying lamp. Follow the manufacturer's directions for cleaning. To protect the bulbs, store the cooled lamp in a safe place where it is protected from breakage. A small covered plastic tub and protective wrapping are helpful in storing the glass parts of various tools and machines. Activity. Test it out. With a partner in class, use a Woods lamp and Table 10.1 to identify skin conditions your classmate may have. Record your findings and communicate them to your partner. Check in. What skin conditions does a Woods lamp reveal? Demonstrate how to safely and effectively use the rotary brush. The main purpose of the rotary brush, also known as a facial brush, is to lightly exfoliate the skin. The brush can be rotated at different speeds and directions. Some brushes are simple rotary. Some come with additional options such as ultrasonic technology that provides additional deep cleansing results. Brushes come in smaller sizes for the face and larger sizes for other areas of the body, such as the back, and they have 2 or 3 small brushes with different textures ranging from soft to firm. In recent years, more advanced technology such as the ultrasonic spatula, used for deep cleansing, has replaced the rotary brush. Figure 10.5. Rotary brush. When to use the rotary brush. Integrating the rotary brush into your service can help you achieve various goals. Use the brush when your goal is to lightly exfoliate the skin without the use of chemicals such as enzymes or peels. Use the brush during the second cleansing step in a facial to save time. Effects of the rotary brush. The effects of using a rotary brush include: the rotary brush provides light exfoliation of the client's skin. Cleansing brushes can stimulate the skin and help soften excess oil, dirt, and cell buildup. Contraindications and best practices for the rotary brush. To prevent harm to your client, it is important to be aware of contraindications and best practices when using the rotary brush. To avoid damaging or further irritating the skin, do not use brushes on acne, coupe rose, fragile, or inflamed skin. Moisten the brush before each use to soften the bristles. More sensitive skin requires a slow, steady rotation and soft brushes with fewer passes. Thicker, oily skin can tolerate a faster speed and firmer brushes with more passes. Fewer passes produce less exfoliation. The brush should not be overused, or it will cause irritations and sensitivity. Apply gentle pressure. Safety and maintenance of the rotary brush. It is important to note that only brush heads that can be fully immersed in a disinfectant of appropriate strength should be used. Some brushes with natural bristles may deteriorate and are prohibited from use due to the inability to clean and disinfect them. Rotary brush machines come with detachable brushes for cleaning. Here are some guidelines for maintaining the brushes. Remove the brushes after each use and wash them thoroughly with soap and water. Thoroughly clean the handpiece, cords and the machine with disinfectant. After manual cleansing, immerse the brushes in a disinfectant for the time recommended in the manufacturer's instructions. It is important to clean, rinse, dry, and store the brushes so that they do not lose their shape when drying. If the bristles become bent or lose their shape, they will not rotate properly. Although they can be stored temporarily in a dry ultraviolet sanitizer, the brushes will break down if left in the ultraviolet sanitizer too long. When they are completely dry, transfer them to a closed container. Mini procedure. The rotary brush. Insert the appropriate size of brush into the handheld device. Apply cleanser or water to the skin. Do not let water or cleanser drip down the face or into the eyes. Use a piece of cotton or 4" by 4" gauze to catch any excess water. Use the brush up to 3 passes on each area, or for approximately 3 to 5 seconds, unless directed otherwise. Limit the number of passes according to the sensitivity of the client's skin or area you are working on. Keep the brush moving across the face at all times, with light pressure and in a circular pattern, ensuring the bristles remain straight and uncompressed throughout the process. Apply water to the bristles as needed, adjust the speed, and begin a horizontal pattern across the forehead. Do not allow the brush to drag the skin. The brush should be damp, but not to the point it is dripping on the client. Wipe excess water on a 4" by 4" pad or towel if necessary. Continue the sequence down to the cheeks, nose, upper lip, chin, jaw, and neck areas. Lift the brush from the skin and turn off the machine, disengaging the attachment. Check in. Name one of the effects of a rotary brush. Demonstrate how to safely and effectively use the steamer. Many estheticians consider the steamer to be the most important machine used in aesthetics. Professional steamers come in various sizes and models. Use only distilled water in the steamer, because the mineral and calcium deposits in tap water can damage the machinery. The steamer takes approximately 5 to 10 minutes to heat up. Do not direct the arm of the steamer toward the client's face until mist begins to flow. The mist/vapor is directed onto the skin's surface by a nozzle at the end of the steamer's arm. Steamers may have a place for an aromatherapy ring on the inside of the nozzle head, and they may have a special feature for using essential oils. A quality steamer will last for years. Inexpensive models break down quickly. It is worth the extra money to buy a good quality steamer that will last and be reliable. Figure 10.6. Steamer. When to use the steamer. Integrating the steamer into your service can help to soften the skin. The steamer is typically used during the second cleanse in a facial. It can be used prior to extractions to soften the skin, but this effect is only temporary. It can be used to soften a facial mask and facilitate its removal. Effects of the steamer. There are many benefits of using a steamer during a service. Steam helps to stimulate circulation, as well as soften sebum, dead cells, and other debris. The warmth relaxes the skin and tissues, making it easier for the esthetician to extract comedones. Steam can also be beneficial for the sinuses and congestion. Steamers with ozone, O3, may have an antiseptic effect on the skin that is beneficial for acne and problematic skin. Steamers with ozone. Ordinary oxygen in the atmosphere consists of 2 oxygen atoms, O2. Ozone consists of 3 oxygen atoms, O3. Ozone is what is created after a lightning storm and has a distinct smell. Ozone also has antiseptic qualities. These molecules have the power to kill bacteria and other microorganisms. That being stated, ozone is also a strong oxidizer that creates free radicals. The third atom can detach from the O3 molecule and reattach to other molecules. Some steamers have ozone mechanisms. High-frequency machines also create ozone. According to the EPA, exposure to ozone affects the respiratory system, can irritate the eyes, and may cause shortness of breath and coughing. OSHA standards for normal exposure should not exceed 0.1 part per million, ppm. Ozone air purifiers are ineffectual and may exceed safe levels of O3. Check the ozone output for machines before purchasing or using one to make sure it is under the maximum exposure limits. Contraindications and best practices for the steamer. It is important to be aware of the contraindications and best practices for the steamer to prevent harming your client. Do not use too much steam on cuprose or inflamed skin, because it dilates the capillaries and follicles, causing more redness and irritation. Avoid placing the steamer arm too close to the face. To avoid burning yourself, never touch the glass jar on the steamer when it is hot. It takes a long time to cool down. Ask your instructor for a demonstration on how to safely remove, clean, and replace the glass jar. Do not leave the room while steaming the client in case the steamer starts spraying water. This may burn the client. Do not overfill the steamer because the steamer may spray excess water and burn the client. Clean the steamer regularly to avoid mineral buildup that causes water to spray and burn the client. Do not let the water level run low in the steamer, as the glass may break in steamers that do not have an automatic shut-off safety mechanism. If the steamer is positioned with the steam directed from below the nose and is too close for the client, try steaming from above the head. Reposition it a few times if necessary to get an even placement of steam across the face. Do not add cold water to the steamer until it has cooled off so as not to break the glass jar. Safety and maintenance of the steamer. To ensure proper usage, always read and follow the manufacturer's directions for the steamer. Following these guidelines will keep your machine in peak working condition for years. After each use, wipe down the outside of the steamer with a disinfectant. At night when the glass jar is completely cooled, unscrew and empty the jar to let it dry. Make sure that the rubber seal along the rim of the jar is clean. Refill the steamer machine with fresh distilled water each morning. Do not overfill. Before each treatment, turn the steamer on to give it a chance to warm up. This will save valuable time when treating each client. Water used inside the steamer should be as free of chemicals and minerals as possible. Therefore, it is always recommended that distilled, not tap, water be used. Most tap water contains chlorine, other chemicals, and mineral deposits. Do not leave water in the steamer overnight or on weekends. If the steamer is not emptied regularly, deposits can collect on the heater element. Empty the jar and lightly clean with vinegar and then with soap and water. Allow the coils to dry. Neglected steamers tend to spit hot water due to the buildup of mineral deposits that occur with daily use. Mineral deposits may appear as a white or yellow crusty film on the heating element. The hot water can land on the client's face and may cause a serious burn. Some steamer models have solid tanks, preventing you from seeing the element, therefore, they need to be cleaned at least 2 times a month. Use a cleaning solution of plain vinegar and water. Never put essential oils or herbs directly into the water. Essential oils are highly active. When dropped directly into a closed jar with boiling water, they can cause excessive spitting of water or, even worse, clog the steamer or cause the glass to break from pressure. Some steamers are equipped with a wick-type apparatus that fits at the mouth of the nozzle. A couple of drops of essential oil can be placed here before the steamer is preheated. The steam picks up the aroma as it vaporizes out into the room. Other steamer models make use of a special container for herbs. These specialized steamers are normally more expensive, however, they provide the esthetician with the added benefit of incorporating therapeutic herbs into the steaming process. You can also put a few drops of essential oil on your hands or a cotton pad or swab and hold it close to the steam for aromatherapy. Do not leave the room when preheating the steamer, or you may forget about it and run the water down too low and shatter the glass. Water levels must be kept above the safety line marked above the element on the glass jar. Not all steamers have automatic shutoffs. Some machines may have automatic regulators that detect the water level. When it becomes too low or empty, a safety switch is triggered, turning off the machine. Some machines have timers that shut off after the set time. Timers are useful, but some may tick and then ding when the timer goes off, which can be a loud and distracting noise. Try before you buy. Always keep a spare glass jar and rubber seal handy. Perform. Procedure 10-1 Use and care for the steamer. Check in. List the benefits of using a steamer. Identify why you should make informed decisions when purchasing equipment as a licensed esthetician. It is important to do your research before purchasing equipment. Regulations define what devices can be used within an esthetician's scope of practice. Another purchasing consideration is insurance coverage for the devices to protect you and your clients. Make sure the manufacturer's claims are accurate and there is clinical evidence to support the claims. It is advisable to go slowly when considering purchasing expensive machines. Warranties and training provided from the manufacturer and distributor are two important considerations when purchasing equipment. Education and training are required for many high-tech machines. Did you know? It may be more affordable to purchase individual machines rather than the all-in-one machines that have the different modalities together on one unit. If anything needs to be repaired, you do not have to ship or be left without all your machines. Advances in science and technology have generated many new high-performance tools that enhance the esthetician's work. Estheticians must continue their education to keep abreast of the latest developments in therapeutic skincare. In this chapter, we have presented an overview of specialized tools and equipment designed to help the esthetician obtain the best results possible in skincare treatments. While some machines are not used on a regular basis, it is good to be familiar with them. See Chapter 13, Advanced Topics and Treatments, for additional information on the more advanced equipment. Study and review the suggested guidelines for operating machinery and practice your skills until you are comfortable working with the equipment. Always be conscientious about safety issues and contraindications when using machines. Clients want instant results, so make sure you can deliver what you promise. Invest in high-quality machines, and your investment will increase your credibility and revenue as an esthetician. What machines would you like to incorporate into your services? High-tech equipment just may be the wave of the future. Check in. Why is it important to research insurance coverage before purchasing a device? Procedure 10-1 Use and care for the steamer. Implements and materials. Standard treatment table setup with linens. Steamer. Goggles or iPads. Distilled water to fill steamer. Moistened 4-inch by 4-inch aesthetics wipes. Gloves. Hand sanitizer. 2 inches by 2 inches aesthetic wipes or cotton rounds. Cleanser to remove makeup. Toner. Moisturizer and sun protection. Disinfectant solution or vinegar. A. Use the steamer. 1. Perform procedure 7-1, pre-service, preparing the treatment room. 2. Place distilled water into the designated container through the fill opening in the top. Check that it is not too full and is level with the maximum fill line. 3. Perform an equipment pre-check and adjust the position of your equipment to ensure client safety and ease of use. Before beginning the facial, position the steamer where you want it. Adjust the height. Do not position the steamer arm/nozzle in the direction of the client. The steamer could sputter hot water onto the client. Wait until the steamer has demonstrated safe and effective steaming prior to directing on the client. 4. Perform procedure 8 to 1, pre-service, prepare the client for treatment. 5. Apply a makeup remover to an aesthetics wipe or cotton round and remove makeup. 6. Apply facial cleaner and massage into the skin. 7. Remove the cleanser from the skin. 8. Using 2" by 2" aesthetics wipes or cotton rounds moistened with toner, remove any residue. 9. Apply eye pads or goggles. 10. Turn on the steamer. If the steamer has a secondary option of ozone or vapor, do not turn on the second switch until steam is visible. 11. When the water is boiling and steam is visible, slowly adjust the steamer arm close to the client. 12. Keep the steam approximately 15 to 18 inches, 37.5 to 45 centimeters, from the face. Place the steamer farther away, if necessary, so that it is warm but not too hot on the face. If placed too close, steam can cause overheating of the skin, possible irritation, or burning. 13. Always check the client's comfort level and ensure even distribution of the steam on the face. If the steamer is positioned with the steam directed from below the nose and is too close for the client, try steaming from above the head. Reposition it as needed to get an even placement of steam across the face. 14. Never leave the client unattended while steaming, as the water can spray out and burn the client. Do not oversteam the skin. Steaming should last 5 to 10 minutes but should be adjusted for less time if needed. 15. When you are ready to discontinue the steam, move the steamer away from the client, then turn off the steamer. 16. Continue with the next step in the facial or close out this procedure. 17. Remove eye pads or goggles, apply moisturizer and sun protection. 18. Perform procedure 8 to 9, post-service procedure. 19. Perform procedure 7 to 2, post-service cleanup and preparation for the next client. B. Cleaning and disinfecting the steamer. 20. Add 2 tablespoons, 10 milliliters, of white vinegar and fill jar to the top fill line with water. 21. Turn on the steamer and let it heat to steaming. Do not turn on the ozone. 22. Let the machine steam for 20 minutes or until the water level is low, but make sure it stays above the bottom low-level line to avoid jar breakage. 23. Turn off the steamer and let the vinegar solution rest in the unit for 15 minutes. Because vinegar has a pungent smell, clean the steamer in your utility room or in an area away from the treatment rooms. Open a window, if possible, when performing maintenance to keep fumes from traveling to other areas of the salon. 24. After it cools, drain the steamer jar completely and then refill with water. Let the steamer heat to steaming again and operate for approximately 10 minutes. If there is still an odor, drain the unit and repeat the process. Caution: do not allow the caustic vinegar and water solution to sit on the heating coil without steaming immediately. If left overnight, it will corrode the copper coils. Note: there is usually a reset button on steamers for additional safety in the event the steamer runs out of water. If the steamer is not running, check the reset button before you call for help. The reset button is ordinarily found on the back of the machine. Procedure 10 to 2. Perform desincrustation and iontophoresis using the galvanic machine. Implements and materials. Standard treatment table setup with linens. Galvanic machine and attachments. Moistened 4" by 4" aesthetics wipes. Gloves. Hand sanitizer. 2" by 2" aesthetics wipes. Cotton rounds. Cleanser. Toner. Water. Desincrustation fluid. Ampoule or serum. Pre-cut gauze face mask or gauze pads. Moisturizer. Sun protection. Disinfectant solution and paper towels for cleanup. Procedure 1. Perform procedure 7 to 1, pre-service, preparing the treatment room. 2. Perform procedure 8 to 1, pre-service, prepare the client for treatment. 3. Apply a makeup remover to an aesthetics wipe or cotton round and remove makeup. 4. Apply a cleanser to the skin. 5. Massage the cleanser into the skin to loosen makeup. 6. Remove the cleanser from the skin. 7. Using 2" by 2" aesthetics wipes or cotton rounds moistened with toner, remove any residue. Part 1, Desincrustation. 8. Cover the entire positive electrode that makes contact with the client with a piece of dampened cotton around the electrode. Give this to the client to hold or place behind the client's shoulder. This electrode is connected to the positive wire. 9. Apply desincrustation fluid to the entire face and then apply the pre-cut gauze face mask over the face. 10. Apply the electrode to the client's forehead. Make sure the electrode is directly on the skin before turning on the galvanic current. 11. Turn the switch to negative and set at the appropriate level for the client. 12. Gently rotate the electrode while gliding it over the client's face. Do not lift the electrode or break contact once the machine is on the skin, or it will be uncomfortable for the client. Keep the electrode as flat as possible and parallel to the skin's surface at all times. 13. Continue in the T-zone area down the nose and into the chin area, or into any area that is oily or needs desincrustation. Best practice is to use desincrustation only in congested areas that need it and avoid areas with dry skin conditions. 14. Keep the electrode constantly moving to avoid overstimulating an area. Keep the skin moist. Add water to face if it gets too dry to glide over the skin. 15. When you are finished, turn off the machine first and then remove the electrode. Rinse the skin thoroughly with moistened aesthetics wipes. 16. Continue with the next step, iontophoresis. Part 2, iontophoresis. 17. Cover the entire positive electrode that makes contact with the client with a piece of dampened cotton around the electrode. Give this to the client to hold or place behind the client's shoulder. This electrode is connected to the positive wire. 18. Apply ampoule or serum to the entire face and then apply the pre-cut gauze face mask over the face. 19. Dip the electrode into water or a conductive gel solution. Apply the electrode to the client's forehead. Make sure the electrode is directly on the skin before turning on the galvanic current. Caution: no metallic electrode should ever be placed directly on the skin. Gels can be used with metallic electrodes as long as the skin is completely covered with the gel and gauze. Pieces of gauze can be moved around the face and held on each section as needed. 20. You have the option of switching positive and negative poles when infusing solutions. Consult the product manufacturer's instructions when doing so. 21. Beginning on the forehead, gently rotate the electrode while gliding it over the client's forehead. Do not lift the electrode or break contact once the machine is on the skin, or it will be uncomfortable to the client. Keep the electrode as flat as possible and parallel to the skin's surface at all times. 22. Continue to the cheeks and the rest of the face. 23. Keep the electrode constantly moving to avoid overstimulating an area. Keep the skin moist and the pads wet. Add water to the pad or face if it gets too dry to glide over the skin. 24. When you are finished, turn off the machine first and then remove the electrode. Remove the gauze and rinse the skin thoroughly. Note: some product companies do not recommend rinsing the serums or ampoule post-treatment. 25. Perform procedure 8 to 9, post-service procedure. 26. Perform procedure 7 to 2, post-service, cleanup and preparation for the next client. Procedure 10-3, use the high-frequency machine. Implements and materials. Standard treatment table setup with linens. High-frequency machine and attachments. Pre-cut gauze face mask or gauze pads. Massage cream, if performing as part of a massage, with the spiral electrode. Moistened 4" by 4" aesthetics wipes. Gloves. Hand sanitizer. 2" by 2" aesthetic wipes or cotton rounds. Cleanser. Toner. Moisturizer. Sun protection. Disinfectant solution and paper towels for cleanup. Procedure. 1. Perform procedure 7-1, pre-service, preparing the treatment room. 2. Perform procedure 8-1, pre-service, prepare the client for treatment. 3. Apply and massage a cleanser suitable to remove makeup into the skin with your gloved hands. 4. Remove the cleanser using 4" by 4" aesthetic wipes or chosen material. 5. Using 2" by 2" aesthetic wipes or cotton rounds moistened with toner, remove any residue. 6. Apply the pre-cut gauze face mask over the face, unless the electrode application listed later in this procedure does not require the gauze. 7. Continue as noted with the appropriate electrode selection as detailed in Table 10.3 and proceed with the indicated steps listed for the specific electrode. 8. Continue with the next step in the facial or close out this procedure with steps 11, 12, and 13. 9. Apply moisturizer and sun protection. 10. Perform procedure 8-9, post-service procedure. 11. Perform procedure 7-2, post-service, cleanup and preparation for the next client. Procedure 10-4, use the spray machine. Implements and materials. Standard treatment table setup with linens. Spray machine. Moistened 4" by 4" aesthetics wipes. Gloves. Hand sanitizer. 2" by 2" aesthetics wipes or cotton rounds. Towel to place under client's chin while spraying mist. Cleanser to remove makeup. Mist solution, freshener solution or toner, 1 part toner, 2 parts distilled water. Moisturizer and sun protection. Disinfectant solution and paper towels for cleanup. Procedure. 1. Perform procedure 7-1, pre-service, preparing the treatment room. 2. Perform procedure 8-1 pre-service, prepare the client for treatment. 3. Apply and massage a cleanser suitable to remove makeup into the skin with your gloved hands. 4. Remove the cleanser from the skin using 4" by 4" aesthetic wipes or chosen material. 5. Using 2" by 2" aesthetic wipes or cotton rounds moistened with toner, remove any residue. 6. If using the spray machine on a high setting, you can place a towel under the client's chin to stop the mist from dripping down the neck. Turn on the power and adjust the velocity of the spray. Remind the client to keep the eyes and mouth closed during the misting. 7. Hold the spray approximately 12 to 15 inches, 30 to 37.5 centimeters, away from the face and mist for approximately 5 to 20 seconds. If necessary, pause and make sure the client can take a breath between the misting. 8. Turn off the power. 9. Perform procedure 8-9, post-service procedure. 10. Perform procedure 7-2, post-service, cleanup and preparation for the next client. Demonstrate how to safely and effectively use the vacuum machine. The vacuum machine, also known as the suction machine, is used in a facial when the esthetician's goal is to remove impurities, stimulate the skin, or perform a machine-aided facial lymphatic massage. The machine uses glass and metal suction cups that come in different sizes and shapes, depending on their use. The movement of these cups across the face and neck mimics the contractions naturally made by the lymph vessels and artificially aids in the movement of lymphatic fluid. Figure 10.7. Vacuum machine. When to use the vacuum machine. Determining when to use the vacuum machine during a service is the first step in using one. This machine can be used after desincrustation and before extractions. It can also be used in place of massage. Effects of the vacuum machine. The vacuum machine serves two main functions: to suction dirt and impurities from the skin, to stimulate the dermal layer as well as lymphatic and blood circulation. Contraindications and best practices for the vacuum machine. It is important to be aware of the contraindications and best practices for the vacuum machine to prevent harming your client. A vacuum machine should not be used on cuprous skin with distended or dilated capillaries or on open lesions. To avoid harming the client's skin, do not use suction on inflamed, rosacea, or cuprous skin. Never suction liquids or oils into the suction device. Avoid using strong suction because it may cause tissue damage or bruising. Holding the skin taut with the proper settings will allow you to avoid damaging the skin. Safety and maintenance for the vacuum machine. To clean and maintain the vacuum machine, follow these guidelines. Clean all glass devices with soap and water and soak them in a disinfectant of appropriate strength. Follow the manufacturer's directions to clean the handpieces and hoses. Normally a filter is located at the end of the hose where the hose attaches to an orifice connected to the machine. The filter may have to be changed frequently, depending on use. Store the tips wrapped in cloth in a covered storage area to protect against breakage. Mini procedure. The vacuum machine. Apply a medium, such as water, to provide slip during the process. Attach the appropriate glass or metal tip to the hose after inserting a piece of cotton into the handpiece as a filter, without blocking the suction pressure. Turn on the power and adjust the suction. With your index finger, cover the finger hole on the handpiece when moving the suction across the skin, starting at either the top or bottom of the client's face. Usually 3 to 5 passes on each area are enough and should be adjusted according to the skin's sensitivity. Slowly move the device horizontally on moistened or damp skin. Keep moving across the face without stopping. Hold the skin taut with the other hand on each area of the face. Switch to the small tip for the nose. Be sure to include the vertical creases near the nose. To avoid pulling on the skin, lift the finger off the hole before lifting the device off the face. Disengage the attachment from the hose. Check in. What are the two effects of the vacuum device? Demonstrate how to safely and effectively use galvanic current. Galvanic current is used to create two significant reactions in aesthetics: chemical desincrustation and ionic iontophoresis. The galvanic machine converts the alternating current received from an electrical outlet into a direct current. Electrons are then allowed to flow continuously in the same direction. This creates a relaxation response that can be regulated to target specific nerve endings in the epidermis. The machine can leave a metallic taste in the mouth, which is normal. Figure 10.8. Galvanic current machine. When to use galvanic current. Galvanic current is used when the esthetician's goal is to prepare the skin for extractions or assist in delivering targeted products to the skin. It can be used in a facial after the exfoliation step and prior to the extraction steps, and can be used prior to masking to deliver ingredients or during the final stages of a facial. Effects of using the galvanic machine. There are two main benefits that occur when using the galvanic machine. Desincrustation causes an alkaline reaction to soften the follicles for deep cleansing. Iontophoresis is used for introducing a water-soluble product into the skin. Caution. Do not use negative galvanic current on skin with broken capillaries or pustular acne conditions, or on a client with high blood pressure or metal implants. Desincrustation. Desincrustation uses galvanic current to create a chemical reaction in the skin that emulsifies sebum and debris in the follicle. To perform desincrustation, a negative pH/alkaline-based, electronegative solution is placed onto the skin's surface. The solution is formulated to remain on the surface of the skin rather than being absorbed. When the esthetician is conducting desincrustation, the client holds the positive electrode, set on the positive polarity. The esthetician uses the negative electrode, set on negative polarity, on the face. This creates a chemical reaction that transforms the sebum of the skin into soap, a process known as saponification. Soap is made from fat and lye, sodium hydroxide. When the electrical current interacts with the salts, sodium chloride, in the skin, it creates the chemical known as sodium hydroxide, or lye. This soapy substance helps dissolve excess oil, clogged follicles, comedones, and other debris on the skin, while softening it at the same time. Various types of electrodes are available for the galvanic machine. The most common are the flat electrode and the roller. To make proper contact, each electrode must be covered with cotton, and the client must hold the electrode whose charge, either positive or negative, is the opposite of the electrode on the skin. Baking soda in water can be used as a desincrustation fluid for anaphoresis. Most water-based serums can be used as iontophoresis products for cataphoresis. Effects of desincrustation. Desincrustation is beneficial for oily or acne skin because it helps soften and relax the debris in the follicle before extractions. Best practices and safety considerations for desincrustation. Keep even contact with the skin once the galvanic machine is on. Electricity is flowing through the electrode, and when it is lifted even slightly, the client may feel a mild tingling or shock. To avoid this sensation, turn off the machine first and then remove the electrode from the skin. Clients should be advised of the possibility of these sensations prior to starting the treatment. Iontophoresis. Iontophoresis is the process of using electric current to introduce water-soluble solutions into the skin. This process allows estheticians to transfer, or penetrate, ions of an applied solution into the deeper layers of the skin. Ions are atoms or molecules that carry an electrical charge. Current flows through conductive solutions from both the positive and negative polarities. This process is known as ionization, the separating of a substance into ions. Theoretically, iontophoresis is based on universal laws of attraction. For example, negative attracts positive, and vice versa. Similar to a magnetic response, iontophoresis creates an exchange of negative and positive ions or charges. The process of ionic penetration takes two forms: cataphoresis, which refers to the infusion of a positive product, and anaphoresis, which refers to the infusion of a negative product, such as a desincrustation fluid. Effects of iontophoresis. Several possible skin reactions and effects can occur during ionization. Table 10.2. Effects from the galvanic current, iontophoresis. Keep even contact with the skin once the galvanic machine is on. Electricity is flowing through the electrode, and when it is lifted even slightly, the client may feel a mild tingling or shock. To avoid this sensation, turn off the machine first and then remove the electrode from the skin. The electrode should be continuously moving at all times. Some machines have a switch on the panel that controls the positive and negative modes so that you do not have to manually switch the red and black wires, but instead move only the switch. Polarity of solutions. You need to always check the labeling of the product to identify the polarity of the ampoule or solution. Slightly acidic pH products are considered positive and are mostly used for iontophoresis. If the product were positive, the client and esthetician would use the opposite electrodes. The technician holds the positive and the client holds the negative. Alkaline, or base, pH products are considered negative and are used for desincrustation. If the product is negative, the esthetician infuses the solution with the electrode set at negative and the esthetician holds the negative electrode. The client holds the positive electrode. Some manufacturers may include ingredients in the same vial that are simultaneously positive and negative. In that case, the product should be ionized for 3 to 5 minutes on negative followed by 3 to 5 minutes on positive. If neither a negative nor a positive polarity is indicated for an ampoule, as a general rule the esthetician should first use the negative pole and then the positive pole. This way you are stimulating and softening the skin first and preparing it for the treatment with anaphoresis, and then ending with the product penetration, skin tightening, and soothing with cataphoresis. Figure 10.9. Galvanic current can stimulate and soften the skin. The molecular weight of a product is also a factor in permeability. Smaller molecules have greater penetration ability, while larger molecules cannot penetrate the skin. Water-based products will penetrate better than oil-based products. Contraindications and best practices for the galvanic machine. To avoid potential health complications, do not use galvanic current on clients with the following conditions: metal implants or a pacemaker, braces, heart conditions, including MVP, also known as mitral valve prolapse, epilepsy, pregnancy, high blood pressure, fever, or any infection, diminished nerve sensibility due to diseases such as diabetes, open or broken skin, example wounds, new scars, or inflamed pustular acne, cuprose skin or rosacea, chronic migraine headaches, apprehension about the use of electrical appliances, safety and maintenance of the galvanic machine. Before attempting to clean the electrodes, always read and follow the manufacturer's directions for cleaning and disinfecting the equipment. Detach the electrode cord from the electrode. Remove any cotton from the electrode and discard. Wash the electrode in warm soapy water to remove any organic material, rinse, and dry. Soak the electrode in disinfectant for the manufacturer's directed time, rinse, dry, and store in a non-airtight container. Never place the metal electrode in an autoclave, unless directed by the manufacturer. Carefully spray and wipe the electrode attachment cord, handpiece, and machine with a disinfectant. Check in. List and define the two main reactions of the galvanic current. What are the contraindications for using a galvanic machine? What are the effects on the skin from anaphoresis? How does the negative pole of the galvanic current affect the skin? Define cataphoresis. Demonstrate how to safely and effectively use the high-frequency machine. The high-frequency machine is an apparatus that utilizes an alternating or sinusoidal current, which is a smooth, repetitive alternating current, and produces a heat effect. The high-frequency oscillating current passes through a device that allows for the selection of a Tesla pulse current. This current can produce a frequency of 60,000 to 200,000 Hz, depending on how it is regulated. The frequency indicates the repetition of the current per second. Because high-frequency current is capable of changing polarity thousands of times per second, it basically has no polarity and in effect does not produce chemical changes. This makes product penetration physically impossible. Product penetration is achieved instead by using the galvanic current. Figure 10.10. High-frequency machine. The rapid oscillation created by the high-frequency machine vibrates water molecules in the skin. This can produce a mild to strong heat effect. It is important to note that aesthetic high-frequency devices have a mild effect. An example of a stronger heat reaction is seen in thermolysis, which is used for electrolysis, permanent hair removal. The high-frequency machine creates noise, and the ozone has a distinctive smell to it. Let clients know what to expect when using high-frequency machines and that this is normal. Electrodes. Several types of direct or indirect electrodes are available with high frequency. Each of these electrodes has unique benefits and features that produce specific physiological reactions in aesthetic treatments. If you use the high-frequency machine, you will need to be trained in the procedure and on how to use the different electrodes. During the manufacturing process, most of the air is removed from high-frequency electrodes, creating a vacuum in the tube. The air is replaced, mainly with neon gas. However, some electrodes may also contain argon gas. As electricity passes through these gases, they emit visible shades of light. Neon gas produces a pink, orange, or red light and is typically used for sensitive skin and aging skin. Argon or rarefied gas produces blue or violet light and is typically used for normal to oily skin and acne-prone skin. Sometimes these lights are inaccurately called infrared or ultraviolet because of their colors. However, there are no infrared or ultraviolet rays in high frequency. In addition to different forms of gas, the electrodes come in different shapes and sizes to accommodate the treatment area. Types and general application of electrodes. There are many types of electrodes that can be used in a high-frequency machine treatment. Refer to Table 10.3 for a breakdown of various types and their applications. Table 10.3. High-frequency electrode reference table. Small mushroom. Place the electrode into the handheld device. Twist it gently into place. Adjust the rheostat to the proper setting if the machine is not automatic. Place an index finger on the glass electrode to ground it until it touches the client's skin, then remove. Glide the electrode over the gauze in circular movements, across the forehead area, and then to the nose, cheeks, and chin areas. To remove from the skin, place an index finger on the electrode to ground it and then remove it. Turn the power switch off and disengage the electrode. Remove the gauze. Large mushroom. The large mushroom is used in the same way as the small mushroom. Another effective way to use this apparatus is to open a piece of cotton gauze and glide the mushroom electrode over the gauze, which is placed on the client's face. This produces a small spray of sparks onto the skin. This treatment is ideal for acne or problematic skin. Facial finish. High frequency may be used at the end of a treatment over cream. Place cotton gauze between the cream on the client's skin and the electrode. Glide in circular motions over the entire area. Remove the gauze. Indirect, spiral. Indirect electrodes are used indirectly to stimulate the skin during massage. This treatment is ideal for sallow and aging skin. Apply cream to the client's face. Do not apply gauze. Give the wire glass electrode to the client, who then holds it with both hands. Place the fingers of one hand on the forehead. With the opposite hand, turn the high frequency on and move to a low setting. Using both hands, perform a piano finger motion, gently tapping the skin. Move around in a systematic manner over the entire face. To discontinue, remove one hand from the skin, turn the power switch off, and disengage the electrode. In order to keep the current flowing, do not lose contact with the skin during this procedure. Sparking, glass tip. A glass tip electrode is used to direct sparking to a specific area such as an acne lesion. It helps disinfect and heal the lesion. Sparking is visible and creates an interesting zapping noise. Place the electrode into the handheld device. Place the glass electrode over the lesion area, removing your finger so that the electrode is not grounded prior to placing on the face so that the area is sparked for a few seconds. Touch the electrode to the blemish for a few seconds and remove. Repeat this a few times. Remove the electrode from the skin by placing the finger once more on the glass. Turn the power switch off and disengage the electrode. Comb, rake. To apply the comb electrode, follow the directions for the mushroom electrode. It is mainly used in a scalp treatment. When to use high frequency. The high-frequency machine is a useful and versatile aesthetic tool. It may be applied after extractions or used over a product but will not penetrate a product as iontophoresis would. The machine also creates ozone, which has a germicidal action on the skin. Effects of high frequency. The high-frequency machine benefits the skin in the following ways. It has an antiseptic and healing effect on the skin. It stimulates circulation. It helps oxygenate the skin. It increases cell metabolism. It helps coagulate and heal any open lesion after extraction by sparking it with the mushroom electrode. It generates a warm feeling that has a relaxing effect on the skin. Contraindications and best practices for high-frequency machines. Be sure to know all the contraindications of using a high-frequency machine before implementing it in treatments. High frequency should not be used on clients with the following conditions or devices. Cuprose skin, inflamed areas, pacemakers, metal implants, heart problems, high blood pressure, braces, epilepsy, pregnancy, body piercings from the waist up. The client should avoid any contact with metal, such as chair arms, jewelry, and metal bobby pins. During the treatment, a burn may occur if such contact is made. Adhere to the following guidelines. To avoid being burned, the client should avoid contact with metal during electrical machine treatments. Clients should remove all jewelry and piercings prior to the treatment. The technician should ground their finger on the electrode prior to applying it to the client and prior to removing it from the client. The electrode should be continuously moving at all times. Electrodes should be gently removed from the handpiece to avoid snapping the electrode. Safety and maintenance for high-frequency machines. Follow these maintenance guidelines for high-frequency machines. After each use, clean the glass electrode by wiping it with a solution of soap and water. Do not use alcohol on electrodes. Do not immerse the electrodes directly in water. Place only the glass end, not the metal, into a disinfectant solution for manufacturer's recommended time. Wipe the entire electrode with a disinfectant-saturated paper towel. Rinse the electrodes. Do not get the metal end wet. Dry with a clean towel and store in a non-airtight, closed container. Do not place electrodes in an ultraviolet machine or in an autoclave. Unless they break or are damaged, most electrodes do not need replacing, but keep in mind that the electrodes are very fragile. Take extra care to wrap them in a soft material and then store them in a drawer where they will not be knocked around or damaged. Some of the newer machines offer inserts for storing the electrodes right on the machine. Be sure to cover the electrodes so they remain clean and undamaged. The high-frequency coil should be replaced after a few years of use if it is losing power. Clean the handpiece, cords, and machine with disinfectant. Check with the manufacturer for additional service requirements. Perform. Procedure 10-3. Use the high-frequency machine. Check in. What is high-frequency used for? Demonstrate how to safely and effectively use spray machines. Spray mists are beneficial in calming and hydrating the skin. The spray machine is part of the vacuum machine and is attached via a hose that is connected to a small plastic bottle with a spray nozzle. Figure 10:11. A spray machine can be used to apply toner. When to use a spray machine? This bottle with the spray nozzle can be filled with a freshener solution or toner, 1 part toner, 2 parts distilled water, to gently mist the client's face after cleansing or another treatment step, such as massage. Effects of using the spray machine. The spray machine affects the skin by adding moisture during or after a treatment and is used to calm and hydrate the skin. Contraindications and best practices for the spray machine. Do not use on clients who have respiratory issues where the spray may cause breathing irritation. Do not allow the spray to drip into a client's eyes, ears, or mouth or run down their neck. Use eye pads for a safety precaution if using the mist extensively. Do not leave toners and other liquids in the spray bottle for extended periods of time or overnight. This may cause the plastic to break down. Do not use the spray machine in a room that is not well ventilated. Safety and maintenance for the spray machine. Here are some general guidelines for spray machine maintenance. After use, clean the spray bottle, cords and machine with disinfectant and follow the cleaning directions supplied by the manufacturer. Flush with distilled water regularly. Mineral buildup in the nozzle of the sprayer should be cleaned monthly or more often. Perform. Procedure 10-4. Use the spray machine. Check in. What are the effects of the spray machine? State the benefits and use of paraffin wax. The paraffin wax heaters that allow for direct immersion of a client's hand or foot in a paraffin bath should not be used due to concerns of cross-contamination. However, modern methods have developed. One method uses a machine that heats up a plastic sleeve filled with paraffin for single-use disposable application. Another technique developed to prevent contamination of the wax is the use of a disposable brush to apply the wax to your client. Figure 10.12. New paraffin wax techniques have been developed using a disposable brush for application to avoid cross-contamination. When to use paraffin wax? The warm paraffin mask is used for hydrating dry skin and is generally applied over a hydrating body lotion to the hands and feet. Effects of using paraffin wax. Paraffin wax allows the esthetician to provide a treatment that offers quick results, but it lasts only for a limited period of time. Contraindications and best practices for paraffin wax. Clients who have compromised skin or skin conditions or general health conditions that are not cleared for use of heat-based modalities are not cleared for paraffin wax treatments. Safety and maintenance. Paraffin wax heaters stay warm at a safe, low level of heat. They must be replenished as you discard the used wax. These heaters tend to take a long time to heat up in the morning. Always use a professional wax bath machine that emits low heat. A substitute heater, such as an electric cooking pot, regulates heat differently and is not recommended. The use of a machine that heats up a plastic sleeve filled with paraffin for single-use disposable applications for the hands and feet prevents cross-contamination. After use, clean machine with disinfectant and follow the cleaning directions supplied by the manufacturer. Check in. What method of applying paraffin wax is best for preventing cross-contamination? State the benefits and use of electric mitts and boots. Electric boots and mitts are similar to electric heating pads and have adjustable settings. Although not commonly used, it is important to understand their function and benefits for a client. Figure 10.13. Electric mitts and boots. When to use electric mitts and boots. Boots and mitts heat the hands and feet to increase circulation and to promote overall relaxation. Often promoted as an add-on to a service, boots and mitts actually perform an important function. The heat helps lotion penetrate, and it soothes aching feet and hands. Effects of electric mitts and boots. Due to the application of heat, electric mitts and boots increase penetration of lotions and creams applied to the skin. Contraindications and best practices for electric mitts and boots. To use electric mitts and boots, put lotion on the client's hands and/or feet and cover with plastic single-use liners before inserting into the warmers. Warm the mitts and/or boots for approximately 10 minutes. Make sure the warmers do not get too hot. If the client feels sweaty, then the lotion cannot penetrate. Safety and maintenance of electric mitts and boots. To clean the electric mitts and boots, wipe them with a disinfectant after each use. Check in. What are the effects of electric mitts and boots?